Have you heard of HIV before?
Yes.
Okay, what's the full meaning of HIV?
Human immune deficiency virus.
Wow, 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 wow. All right, this ID Health on the street. As you all know, every 1st of December, we observe World HIV Day. And it's a good one to, bring to awareness what HIV is all about, and also reduce the stigmatization that comes with HIV. So today we are in the city of Owerri. I will be asking people their experiences or how they will feel if they hear that somebody close to them has HIV. Okay. So I suggest you follow us. Let's go hear what they have to say. All right. Good day. What's the name?
Good afternoon. I'm Miracle.
All right. Miracle. This is ID Medic on the street. And every 1st of December, we observe World HIV Day. Okay. So we want to know, like, how would you feel if you hear that a friend or maybe a roommate has HIV? What would be your reaction?
First off, I'll feel sad for the
Okay.
person because HIV it's not a disease that you even wish upon an enemy,
All right.
more so a friend or a roommate. So this is it. Because I'm educated on the ways to both prevent and reduce the effects of HIV, I'll advise the person to seek medical help,
All
take
right.
antiretroviral drugs, and then again, try not to pass it to other persons by blood, sexual transmission, and so on. I'm not going to stigmatize the person because I was taught stigmatization of HIV and AIDS patients under HIV and AIDS, and we were told it is wrong on all forms. You should not stigmatize anybody for the disease they are, or the ill health they are going through. So there are many ways to avoid this. There are many ways to prevent it. And even if the person somehow got it, by omission or mistake on the person's part, because nowadays you're told that when you before you donate your blood, you should be checked. You can
Exactly.
remind the medical personnel to check you if the person forgets because his country.
Um,
And then if you one way or the other gets it, it's just to take drugs. If you cannot afford the drugs, because of course the drugs are expensive, you have to go to a hospital and seek other remedies,
yeah.
because I will not lie, I'm not a medical personnel, so I don't really
No.
know the intricacies of what
Yeah.
should go on
Yeah.
outside the drugs.
Most HIV drugs are given for free. They are
Oh,
sponsored by NGOs and many other
oh
organizations.
wow, that's new.
Okay, so once anybody has HIV or is diagnosed with HIV, the best thing to do is go for register with FMC or anyone close to you. It's usually given free of charge. Okay, so thank you very much. Even delighted. I was saying when you started your explanation, I thought you were medically inclined, but then it's cool. Health education should be for all, and that's what IDealmedhealth stands for. Okay, we
Okay.
work to make sure that every household knows the rudiments of health education. Thank you once more. What was that your name again?
Miracle.
Okay, Miracle. One more thing. Okay, you have your phone with you.
Yes.
Okay, you can go check our YouTube channel. We just started.
All
So
right.
you can do it. So what's the name?
Blessing.
Okay.
First of all,
Mm.
I will just disassociate with the person because
Oh, why would you disassociate yourself with the person now?
if I can contact it now.
Oh, nope. It does not work that way. You can't contract HIV by hugging or by even having same this the
Like I
equipment with the
said,
person.
is blood transfusion. Maybe
I understand it can be passed through blood, but then if I should touch you this way, does not mean that okay, I can give you HIV through hugging. Understand? So you will disassociate with yourself from the person. That would be okay. It's fine. It's fine, but then it's not the right thing to do. Okay, the right thing to do is to advise the person to go seek medical attention. Okay, and then if you take your drugs, it will get to a point that you cannot even transmit it if you keep taking it. Understand? So HIV is not a death sentence. If you hear anybody that has it, don't run from the person. Welcome the person, and most importantly, advise the person to seek medical attention. Okay, thank you very much. All right, welcome on IDealmedhealth on the street, and today we are with
Sophia.
Sophia.
It's simple now. Try to get myself away or to be safe, to be on the safer side. So I'll try to get another apartment, or even if I'm to stay with the person, I'll be mindful of things I use and how I use them. And
Okay.
yes. So
But HIV cannot be transmitted by just using things with the person and all that.
accidentally, some things can actually happen. Maybe you might say, okay, as Rumina, let you lose her hair, raise up stuff. If it's
Yeah.
just mistake cut, or
Yeah.
you now if you want clean your nails and then to cut you, you did not infected. So that is it. Now you be careful.
Yeah, I understand, but
Mm.
you don't have to like stigmatize somebody that is HIV positive. Understand? The best thing to do in scenarios like this is to advise the person to go seek medical attention. Okay, with the presence of antiretroviral drugs, you can live with anybody can live with HIV. Okay,
I
to the
know.
level that it will not even be detected in the bloodstream. Okay, so that's how effective those drugs are if you take them as advised. Okay, so you don't have to run from the person, you don't have to leave your house for the person. So we want to know your opinion on this, because okay, what would be your reaction if you hear that your roommate has HIV?
Nothing like that too. Because I don't I don't fathom such imagination. I don't get such imagination. But well, it will be surprising, but I don't think any of my roommates would have such.
Oh,
Because
it's just
I understand.
normal stuff now. It's not.
I understand, but I'll be very sad though. And I'll definitely know that I've gotten to it.
No, the transmission doesn't happen
Yeah,
like
it
that.
doesn't happen, but I don't know how to see it, but
Like, is it that you will start running from the person,
not that I
or
was start running for a person, but definitely you'll be like, this person I've been with for quite some many years. He
Yeah.
has this thing. So you get, imagine maybe, yes, we don't transmit it from eating, using their stores, and but maybe there might be something you might be using, maybe like a nail clipper now.
get?
There's a way you cut maybe your skin, maybe with a
Yeah.
nail clipper. I don't know your roommate has already used it. So you
Okay.
get now. So
Yeah.
I'll be sad to be honest.
Yeah, I get.
Mm.
So, being sad is not enough. What would you do? Like, what would you do?
What do you expect me to do?
Okay,
I'll not do anything now.
yeah, this is what you should do. In case you hear that somebody very close to you has HIV, okay, the best thing to do is to encourage them to seek medical attention. Okay, and the drugs are free. They are sponsored free of charge
That's
by
by the IVH. By the
no,
IVH.
not us, NGOs. Okay, once
NGO.
you get to any federal or most states, okay, those drugs are given free of charge.
Okay.
Okay, once they know that somebody has HIV. So in scenarios like that, just encourage them, go take your drugs, and then encourage them to take the drugs.
But I heard that drugs are not free now.
No, they are free. I'm telling you.
That's, I've forgotten one of the names of the drug.
Antiretroviral drugs
Yeah, yeah,
are
yeah, yeah,
free.
yeah.
Once you get to any FMC, they are given free of charge. Okay, because some non-governmental organizations do sponsor those things.
Okay,
Understand?
I see.
So
Okay.
normally, if you are getting them, like, it will be very, very expensive. But those ones usually take care of them.
Okay.
All right, thank you very much,
It's
sir.
nice speaking with you.
Same here. Met this curious boy that wants to know what we are doing. Okay, what's that your name?
Victory.
Victory. Okay, Victory. Have you heard of HIV before?
Yes.
Okay, what's the full meaning of HIV?
Human immune deficiency virus.
Wow, 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 wow. I'm impressed. This guy, we suppose make face of IDealmedhealth. Walai. Oh, what class are you?
Basic 6.
Basic 6.
Yes.
Wow, this is encouraging. As I know, in fact, this one wey you do now sweet me. Wallahi. I suppose get money here now. Hmm? I suppose get money never left. Boy, hold this one. This question wey you answer sweet me.
Thank you.
Yeah. So then another thing. What would you advise anybody to do when they have HIV?
I'll advise them that they should go and take a drug that will cure the HIV.
Wow, okay. You know, HIV has no cure, okay? So you advise them to go see their doctor and encourage them to take proper medication. All right. Thank you very much, boy. I wish I can see you next time. You are doing great. Thank you. Thank you. All right, we have come to the end of this section. As you know, I will still tell you this is IDealmedhealth on the street. Do well to subscribe to our YouTube channel. That's the only thing you can do for us. Just use and encourage us more. And then secondly, you know HIV is not a death sentence. Okay? When you properly take your medication, it will get to a point the viral load will reduce drastically and it will not even be detected in the bloodstream. That's the good news. Okay? Medicine is doing wonders, medications are doing wonders, and to that level, you can't even transmit it to
IdealmedHealth.
anybody. Okay,
Create
so do
a
well to share
healthy
this good
world.
news with others that HIV is not a death sentence and there shouldn't be discrimination.